I've just found the coolest doctor in the world. He asks you to indulge when you want. He wears a leather jacket. He's got a tattoo. It's somebody who is a doctor, but also closer to the work that I do. He's an editor. He's not just any editor. He's the editor for the most respected, peer-reviewed medical journal in the world. Biggest issue with India right now is not US tariffs. It's actually air pollution. Why do you think the government has not recognized the problem, not taken it at war footing, or even has a plan?
It requires government to recognise that this is causing a problem. Why is my government happy to have 1.5 million citizens dying every year of preventable causes? That is not acceptable. Why isn't the public agitated more? Why aren't they asking more questions of their politicians? Why are they not saying, this is not acceptable. We insist that, and if you don't do it, we're going to vote you out and vote somebody else in. I would just plead on my knees, don't let your politicians off the hook. They're there to represent you. The idea of having a date where you're going to be this developed nation 2047, fantastic. It's like I'm driving at 200 miles an hour down a road without a seatbelt and without a helmet.
The Lancet did come out with a report saying that 4 million people died because of the pandemic. That got you into some trouble with the government, didn't it?
It did. That's not the story they wanted to tell about India. One of the factors that I found really paradoxical, 4 million dead after the pandemic in India. And yet, you go and do a survey and you find that an enormous number of people trust the government. I mean, trust in the government's gone up after the pandemic. It hasn't gone down, which I find weird.
But have we learned?
No, you haven't. You haven't learned. If you can't even admit that there was this level of mortality and there was this level of failure, which means, I'm afraid to say, when the next virus comes, you're not going to be ready and you will see millions of Indians unnecessarily die, which would be a tragedy. I don't want to be the kind of doctor that goes around just saying, don't drink, don't smoke, don't do this, don't do that. It's all about don't do things. What about doing things that bring pleasure to your life?
I think it's a good time to put an advisory on any smoking and any kind of alcohol is injurious to health. इंटरनेट की नहीं, डॉक्टर वेरीफाइड न्यूज़ ही देखिए। All right, our guest today at Doctor versus Internet is somebody who is a doctor, but also closer to the work that I do. He's an editor. He's not just any editor. He's the editor for the most respected peer-reviewed medical journal in the world. If you don't know what I'm talking about, it's the Lancet. What particularly brings me to have Richard over for this podcast is because he believes that when we talk about health, it cannot just be about hospitals and doctors and medicine. It has to be about politics, it has to be about access, and it has to be about people. That kind of outlook is missing in the world perhaps today. He also gains our respect here on Health Wealth because he's not just seen as somebody who does neutral observation of what's happening. He's not afraid to wear his heart on his sleeve. He calls out governments in power. He calls out healthcare mixing with politics. And he's also been very outspoken about some of the biggest pandemic mismanagements, etc., here in the country. So with that, please say hello.
Hello.
To Richard Horton. How are you doing?
I am doing great, and I'm so happy to be here in India. It's been a long time since I've been here. The pandemic stopped me from coming, so I'm back.
So after the pandemic, this is your first trip to
This is
India.
my first trip, absolutely. And
How
my
lovely.
goal now is to come every year for as long as I can.
What brings you to India apart from our lovely air?
I know, I've been breathing it all. We launched a commission, a Lancet Commission, that's looking at a citizen-centered Indian health system. And this was a commission that was led by Indian researchers here, across the country, and also an Indian diaspora. And it's, if I may say so, immodestly, it's an absolutely blisteringly fantastic piece of work. And it recognizes the amazing achievements India's made in the last 20 years, particularly, but also it sets out the agenda for the future, because there are some big issues that India needs to address if it's going to achieve the success it deserves to achieve.
Right. So great things that India has achieved, but also great challenges that the report talks about.
Yeah, and we should really celebrate some of the challenges before we get on to the tough stuff. The National Rural Health Mission set out a basic primary healthcare system for the country, which didn't exist before. The creation of ASHAs was probably the single most important intervention that India has made in, honestly, decades, centuries. It's amazing. Yeah. And actually world leading. The idea that you create a cadre of community health workers, fantastic. And I love the fact that ASHAs has got the word activist in, because they are activists for health, and that's what we need. We need more activists for health. But then also the national health strategies that have been created. There's been this consistent commitment over 20 years. And you're the pharmacy of the world. I mean, it is remarkable. But even so, let's be honest, there are some problems. So we do a lot of work in China. 1.4 billion people, just like here, 1.4 billion people. The life expectancy of an average Chinese citizen is 80 years. What's the life expectancy of an average Indian citizen?
70.
Exactly, 71 years. So why should the Indian people expect to live 9 years less than somebody living in China? It's not acceptable. There should be rioting in the streets about the fact that this is an unacceptable challenge that just needs to be addressed. So I want to see health be top of the political agenda here in India. You mentioned politics earlier, and thank you for doing so, because sometimes health is presented as a very technical issue. It's science, it's doctors, it's boring. It's not. It is highly political, but in a good way. I come from a country, the United Kingdom, where the National Health Service was created after the Second World War. That wasn't a technical success. It was about politics. It was about a new Labour government that came into office in 1945 and wanted to reinvent a country, reinvent the nation after being just destroyed during World War II. And the health service was the way to tell about the renaissance of a country. So what I want to do, and what this commission has done, is to try to tell the story of India through the lens of health. And the story of India through the lens of health during the past 2 decades is one to be immensely proud of. But now, looking over the next generation, the next 20 years, we want to tell a different story, an even better story, a story about the aspirations of young people, about leadership in the world today. And that's what we're trying to offer with this work.
You talk about Story of India. If you had to give it a title, this book of yours, this report of yours, is there a title that comes to mind?
Well, we just did a session at the Jaipur Literary Festival, which I've got to tell you was the best literary festival I've ever been to in the world. Oh my God. I've been to a lot of literary festivals, but this was something else. I mean, this was a carnival of ideas and people, and I learned so much from it, actually. It was just superb. And the title of our session was called The Pulse of a Nation. And I think that's the way we should think about it. What we're trying to do here is to take the pulse of a nation, and what we want to do is to accelerate that pulse of a nation. We want to give a shot of adrenaline to this country. And, there was a book written by Amartya Sen and Jean Jaurès about just over a decade ago, called An Uncertain Glory. And it was a fantastic book, an analysis of India today, and particularly around health. And they said, and made a very convincing case, that health was the biggest adversity facing the country. And I think today that is still true. Health is the biggest adversity facing the country. Because just think about it, okay? Health is special. If you don't have health, you can't do anything else.
Yep.
If I'm sick, I can't work, I can't play, I can't love, I can't do anything. I am diminished as a person. If my health is bad, then the doorway through which my future lies is narrowed.
Yep.
So I think health has special moral importance in society. It's different to everything else. So we need to give it that special moral importance and take it more seriously than we do. In my country, health is always number one or number two in the political agenda in the
And
media.
in India?
Well, in India, absolutely. Answer your own question, because it's not number one or number two, is it? It's
not even
barely
number.
discussed. I know. I've been looking at the newspapers every single day. Okay, it's great. Air pollution is on the front page of most newspapers, but health, not at all.
Yeah.
And that isn't right. We should be having a vigorous debate about health, and families should be demanding, asking more of their governments, whether in states or at the federal level. Health matters. And I mean, I'm a father. It's about the future of our children.
Yeah.
It's about the future of the next generation. And health is central to that.
Yeah. I do think, however, that there is a paradigm shift in which at least urban India now looks at health. I think it started with the pandemic, and now there are more and more young Indians who are educating themselves, their kids, and their parents to stay healthy. I think it's also depicted in the massive rise of wellness, industry that we've seen in India, across the globe, of course, but here as well. Help me understand a little bit about what, according to you, is the biggest health issue that urban India faces today?
In one word, quality. So 20 years ago, when I first started coming to India, the big issue was access. There wasn't enough access to healthcare. Most families across the country couldn't get to see a primary care doctor or even a specialist. And even if they could, it was way too expensive. Now, thanks to ASHAs and a pretty rudimentary but still pretty good primary healthcare system, access isn't such a problem. But now what we know is, and what this commission showed, more people die in India because of poor quality care than they do because of lack of access to care. So just think about that for a moment. You're ill, you struggled your way into the health system, you've got to see whether it's a doctor or an ASHA or whatever, a traditional practitioner. You've got through the system, you've got through the bureaucracy, and then you die. And you die not because you haven't found somebody, but because you got poor quality care.
Yeah.
They've made the wrong diagnosis. They've given you the wrong treatment, the wrong drug, and then they haven't followed you up properly. So quality is the big issue now. And I think this is an absolute inflection point in the history of this country. That it's not about more medicine, it's about better medicine. Not more health, but better health. And so we should be figuring out, why are we not getting the quality of care that we should be expecting? And it's partly because, if I just take doctors as an example, you qualify as a doctor at the age of, say, 25, and then you can practice for 40 years, and nobody pays attention to what you're doing. There's no relicensing, no checking on whether you're doing good or bad medicine. I mean, this is mad. I mean, there's almost no other profession where that would take place. I mean, again, in the UK, and we learnt our lesson. I don't want to say we're perfect. We learnt our lesson because we made mistakes too. But now, every 5 years, a doctor has to go through a process of what's called revalidation, where they have to prove that they are competent to practice medicine. Well, why not? Why not here in India? Why shouldn't doctors have to prove at a regular basis that they're good enough to keep practicing medicine, so that you maintain the quality of care? But this quality issue is now a national crisis. I'll give you one example. Antibiotics. You have a cold and you go and see your doctor. Unfortunately, a lot of people expect to get an antibiotic. Well, except a cold is caused by a virus, not a bacterium. So an antibiotic's not going to make any difference at all. But the healthcare practitioner, because they're trying to be nice to the patient, prescribes an antibiotic to get rid of them often. Big mistake. Because then the result is you get antimicrobial resistance. And we have a global pandemic of antimicrobial resistance. Literally 5 million people a year are dying because of antimicrobial resistance. So if you may, and this is a global problem. So if a doctor prescribes an antibiotic somewhere in India, and then that contributes to AMR, antimicrobial resistance, they're not going to cause just a national problem. This is a global problem.
Yep.
So we really have to fix this. So where's the Indian Medical Association on this? Where are the national authorities on setting standards for prescribing and for
But
clinical
it's not
care?
just on doctors when it comes
It's
to
not.
AMR
You're right.
in India. A lot of people, we have access, you're right. We have access to great medicines, great doctors. But that also means that I can today in India just walk up to my chemist and ask for a medicine. The chemist is like this quasi-doctor. He's the one who's prescribing me meds, often not the right ones, but generally even for a headache, they might just give you something that you don't need. So the problem has to come, don't you think, largely with, I often feel India needs an FDA kind of body.
Absolutely.
India needs a FDA kind of controlling body that has teeth, that has power, and that has influence over everybody, including your pharmaceutical industry, doctors, and also government.
Yeah.
Right? So you've got to cover all those bases. Is that what's missing?
Well, I think there's a general problem that affects the private sector, the public sector, healthcare, all the professions, and that is a desperate lack of regulation. There are no standards. And again, I want to be humble about this because I'm saying this because of mistakes that have been made in my country over many, many decades. And the lesson that we've learned is that if you just allow people to do anything and you trust people to do anything, trust is not the answer. And I know it sounds reasonable. Look, you've got a great pharmacist, you've got a great doctor, you've got great institutions. Surely we can trust them in society. And the answer is no, you can't. You can't, because medicine is just like a microcosm of the rest of the world. There are good people and sometimes there are not so good people. There are quality people and sometimes not so quality people. It's like any other sphere of life. So you do need to have good regulations to maintain high quality practice.
What does India need on regulation?
Well, I tell you what we need. We need political commitment. We need politicians to understand that they have to lead. It's only politicians, this is where the politics comes in, it's only politicians who can say, you know what, this is unacceptable. We do need an FDA. We do need licensing of doctors every 5 years. We do need pharmacists to be checked regularly to make sure they're not giving out medicines that they shouldn't be giving out. We do need a nursing council to make sure that the quality of nursing and midwifery is good. That has to come from politicians because it's politicians who are accountable to the people because they get voted in. Unfortunately, doctors aren't voted in to become a doctor. Nurses aren't voted in to become a nurse. So they don't feel accountable to the public. The only people who are accountable to the public are politicians. So we need to hold the feet of politicians to the fire. It's the politicians who are making promises to the people. They're making commitments to the people. So hold them accountable for what they're saying. Make sure that they deliver. So this is where it needs to become a political issue.
I ask you these questions because our health allocations have been abysmally low.
They have.
Even compared to some of our neighbors in terms of GDP allocations, percentages, etc., we are so low.
Yeah.
Despite that, we have some of the best doctors in the world, which are Indians. We have the best pharmacy in the world, which come from Indian bodies as well. So if you had to make a suggestion to India's health minister today on what he should be doing to fix our basic health infrastructure, what would you want them to do?
Okay, well, that's a great question. And look, I'm an outsider, okay? And there's a history between my country and your country. So I want to be careful here.
Yeah.
So look, it's interesting if you look at this country as a whole, it's complicated. Maybe 5% of people in this country have access to the quality of care that we would expect in a Western nation. 70% of people in this country have very, very little access to quality of care, if anything. I mean, really, 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 it's really, really not good. And then there's a 25% middle class who, we've got to figure out There's an opportunity for better care, social insurance that can deliver that better care. So there's not a single magic bullet for the Indian health system, is my point.
Yeah.
Because it's complicated. One person said to me this week, it's ungovernable. The Indian health system is ungovernable, which I feel is defeatist. It's saying that there's nothing one can do about it. I think, and this sounds a very, very boring answer, but I think it's true. We need to create incentives for health practitioners and politicians to do the right thing, to invest in health. Just to take an example, doctors are allowed to go and work in the private sector, even if they're supposed to work in the public sector. So there's a lot of absenteeism of doctors. So I might want to go and see my doctor here in India, and I leave my local town, and it might take me a day to get to the city to see the doctor and find out the doctor's not there because the doctor's playing hooky and going off and working in the private sector. So there's no sense of, there's no incentive for the doctor working in the public sector.
How do you fix that?
Well, it's incentives. The doctor needs to be incentivized to stay in the public sector. That means the government has to invest more in the public sector. So it comes down to what you were saying. Health has to be a greater political priority. You need to invest more in the public sector. You need to build up the public sector so that it has the capacity and the respect of the public. Because at the moment, I mean, it's interesting. Take primary care. Most people in India, if they have a health problem, don't go and see their general practitioner, as we would call it in the UK. They go straight to the specialist.
Yep.
And I understand why. If I had a sick child, would I want to go and see my primary care doctor? Probably not. I would want to go and see the pediatrician expert.
Yeah.
Well, that's not acceptable. You should demand, actually, a level of quality in the primary care system, your general practitioner, so that if you have a sick child, you know that if you're going to go and see the doctor, you're going to get good care. But at the moment, you can't guarantee that. So you need the political commitment. You need the money. You need the focus on quality so that you can expect to get good care. So it's not a simple thing. It's multiple things that need to be done. Ultimately, though, it's making sure that health is, I'm sorry to say it again, top of the political agenda.
But India also has, and this is part of the Lancet report as well recently that you've released. You talk about there is a fee-for-service model. Do you think India can, or at least urban India can, move to a fee-for-fitness model, which is we incentivize a system to ensure you don't enter the clinics?
You know what?
A system which keeps you healthy, not disease-free.
If you figured the solution out to your question, you'd win a Nobel Prize. Because that is the big problem. At the moment, we are paying hospitals and paying the system to deal with disease. We're not paying for them to create health. We don't have a health-creating society. We have a diseased society. It's a national disease service, not a national health service. So this is a big challenge, and it's right. Unfortunately, families are becoming impoverished because of health. There are some states where as many as a quarter of families are going through what is called, the technical term is catastrophic out-of-pocket expenditure. That's where you're spending more than 10% of your family income on disease. A member of your family gets cancer or any chronic disease, and suddenly the family is tipped into poverty. Well, this is not acceptable. This is absolutely not acceptable in a country of the overall wealth of India. Should not be going through that. But in order for that not to happen, a very, very basic level of healthcare should be available to
But the government of India did come up with a system. It's called Ayushman Bharat.
Yes.
They have a system in place where they say there'll be a minimum service provided and it will not be limited to only public hospitals. They've roped in private players as well. What are your thoughts on that?
So Ayushman Bharat is a really good system, and there are various components of it.
I see a but coming.
There is a but, and the but is quality. The but is that, again, we've got access, but we don't have regulation on quality. And so that's why you're seeing, unfortunately, irrational care completely irrational care. And where you've got irrational care, you're seeing people suffer when they don't need to suffer. Now, 2/3, this country's gone through a transition. 2/3 of deaths in India are from chronic diseases, cardiovascular disease, cancer, respiratory disease. 20, 30 years ago, infectious disease was the big problem, but there's not so much now. The health system hasn't adapted. So are we diagnosing high blood pressure in people? Are we diagnosing
Diabetes.
obesity? And diabetes. People say India's the diabetes capital of the world. That's mainly because of obesity driving that. But the point is, we've got this completely different landscape of disease compared with 20 or 30 years ago. And the country, by which I mean the governments at state level and federal level, haven't caught up with this, what's called epidemiological transition, the transition from infectious disease to chronic disease. I'll give you another problem. The fact is, we're all living to be older, which is a great thing. It's great that life expectancy...
What do you mean by that?
But now you're going to see this massive burden of dementia. We're going to see an epidemic of dementia around the world as populations get older. So I want to see.
How so?
Because dementia is going to be the new challenge we face as our populations get older. Now, I want India's population to live as long as China's population. You should be having 9 years of extra life. You shouldn't be dying prematurely. And at the moment, Indians are dying prematurely when they shouldn't. But as they live longer, there will be a proportion of people who do get dementia. And so we need to think about, so what are the services going to be? And that's not healthcare, that's going to be social care. So what's the social care system going to be? How are families going to cope with an older relative who develops dementia? This needs to be a national conversation about how you're going to create a system of social care. I mean, and I say, again, in all humility, we haven't got the answer in the UK. We're not there yet. But Japan has thought about this. So they've created a system whereby from a very early age, they pay something called long-term care insurance. So they're paying when they're young so that by the time they get to 70 or 80 or more, they've built up a pot of money which can then pay for their social care. So we really have to be thinking in the long term. And the trouble with democracy, I love democracy, and India's got the world's greatest and most vibrant democracy. No question about that. But the problem with democracy is we only think in terms of 4 or 5 years of the electoral cycle. And so there's no incentive for any politician to think about, well, what's the situation going to be in 2100?
Yeah.
I mean, and in 2100, that's when we're going to have an epidemic of dementia. In 2100, that's when we're going to need a social care system. So we've got to ask our politicians to take a much longer term view than they have currently. And these should be the national debates that we have.
You think India is still obsessed in its policy and its thinking into how the West operated? And do you think it should look more east?
Well, I tell you, don't look towards the West because we've just made a litany of mistakes, okay? So what I'm saying now is not because I have any wisdom. It's because of all the mistakes we've made and trying to learn from those.
Okay.
But you have got the opportunity to leapfrog the West's mistakes. And I really mean it. You know, you've got there is this moment, this inflection point in the history of India where because of your digital technology industry that you have here, you really can change the way you deliver and think about healthcare and connect people to the health system. If you're living in whether it's a rural community or even an urban community, digital technology has the possibilities to connect you to the health system in ways that many other countries don't.
Talking about digital technology, Elon Musk recently said that the world will not need doctors anymore. As a doctor yourself,
oh my God,
and as somebody who understands healthcare like no other, how would you answer him?
Of course we will need doctors. You know, if Grok is going to be my doctor of the future, his AI tool on Twitter, or X as we should call it, God help us. Seriously, that is going to be. Look, if I'm a patient and I want to go and see something, I want a human face in front of me. I want to be able to look in your eyes. And I want to get some empathy from you. And I want to tell you my story. And I want you to react to my story. And I want you to give me advice. And maybe I want you to hold my hand. And maybe I want you to guide me through the system in a humane, thoughtful, considerate way. And that's human being. That's compassion. That's.
But what about access to information? And to be honest, Elon Musk is not the only one. Sam Altman's OpenAI now has a portal only on health.
Yeah, no, sure.
They also came out with a report that in the first year of its launch, the maximum questions that were asked of ChatGPT were actually on mental health.
Yeah.
So in a situation like this, do you see AI integrating with healthcare, or do you think it's been, as they say, bastardized?
No, if I think back, so I'm old, and I have seen technologies come in over the last 30 or 40 years in medicine. And often people have said, oh, this is going to transform everything. We're not going to need doctors. We're not going to need hospitals. This is all going to be, a revolution. And of course, what happens is, just like with any other technology, it gets integrated into the existing system. It finds its place. I still use a pen. I still use paper. I still read books, actual physical books.
I'm not old, but I'm also doing it, just FYI, just to call it out.
So, AI is going to have it is already having an important role to play, and it will have an increasingly important role to play. But the idea we're all going to be talking to robots and replicants or whatever they're going to be called. Sorry, that's.
But how do you see that integration happen for a place like India?
Well, so this is where I want to be careful, because the idea that you can substitute a technology for a human being and somehow leapfrog, accelerate improvements in the health system, be careful with that. Be careful with that, because judgment is important. Mm-hmm. And these tools at the moment don't have judgment. They hallucinate, they make mistakes. And of course, humans make mistakes too, but what you're getting with a human being is you're getting their experience. So with an AI tool, it might have been trained on the world's literature, but it's not trained on the world's experience. You, as a human being, will have a certain amount of what we would call tacit knowledge that isn't written down, that's not in a textbook, that's not in a screen, that's not in an archive, not in a medical journal, not in a laboratory, but it's in your head. And it's in your head because during the course of your life, you've accumulated this wisdom. And that's what happens with a nurse, a doctor, a midwife, an usher. And you can't codify that. You can't put that in an AI tool. So don't lose that. So I would say we use the word tool deliberately. An AI tool is a tool. It's there to help a human being. But don't lose the human being. The human being is special. The human being is, quintessentially, absolutely the most important person in the health system. So let's be careful here. Let's not get carried away by too much. And also remember, please, that all these AI companies, they're there to make money. So, they're not some humanitarian organization that's trying to do this just for the good of us all. They're there to make a lot of money. So let's not be exploited by them. Let's us control them. And the AI industry, it's like the private sector in India. It's completely unregulated. It's moving fast, and that is not a helpful place to be. And it's all located in the United States with a government that doesn't want to regulate them. So we're actually in trouble here.
I asked you in the beginning, and you said very clearly that India is at that junction where access is perhaps not as big an issue as quality is. Of late, in the past 6 months only, we've had questions on that quality. Quality of air, quality of water, quality of our medicines as well. We had deaths reported in at least 2 states because of cough syrups which weren't right. These cough syrups, which did create alarm world over, were perhaps still being distributed in India. How do we, and this with the context that we are the pharmacy of the world,
Yes.
right? We make these medicines accessible, affordable to our very wide, varied, complicated population. Where are we there, and how do we fix this?
Well, what is your Food and Drug Administration? What's the equivalent FDA in
So
India?
we have something called a CDSCO. A CDSCO is like a drug controller. But the problem here is that the drug controller can only give advisories.
Well, that's
That's
a big problem.
Yeah. And also health is a concurrent subject, meaning the central government and the state government both have ownership. Not one, but both. So they both can pass laws, can give directives. There is no one centralized body taking ownership.
So I understand the complexity of federal and state dynamics, but there needs to be a little bit of, I don't want to say authoritarianism here, but there needs to be a little bit of structure. And the only way to bring some quality control here is to have a national body, not having 28 different bodies for each individual state, but a national body that sets standards for medicines and has the authority to punish manufacturers if mistakes are made. It's really, really critical that that's the case. I mean, if I look back at the history of my country, whether it was thalidomide or whatever, you need to have a regulatory authority that is able to say, this drug is not acceptable and we are going to demand that it gets withdrawn. And if a pharmaceutical company, for example, breaches an advertising regulation, then they get punished for doing so. So this is where, and there's a consistent pattern here, isn't there, in our conversation. India's moving so fast. I mean, it's moving so fast. I mean, you're really, you're so...
There are no guardrails.
Exactly. You're accelerating so quickly. And it's fantastic to see as an outsider. I was here in 2011 when we launched the previous series on health in India. And I can see in this time, this country has completely reinvented itself. But there's
at what cost?
Yeah, absolutely. And you kind of think like, it's like I'm driving at 200 miles an hour down a road without a seatbelt and without a helmet or something. And this is madness. You're sacrificing safety for getting to some destination. And I really admire Visket Bharat. The idea of having a date where you're going to be this developed nation, 2047, fantastic. We don't have that. I think it's wonderful that you've got a goal that you're heading for. Every country needs a goal. And one of the criticisms of the West is it has no goal. It's become decadent and a rather sort of decaying set of empires. You've got a goal, 2047, brilliant. But you're heading there at 200 miles an hour and you could crash if you're not careful. And there have already been some examples. You've just given one about the cough syrups. There are some examples in this commission we've published this week on quality and catastrophic health expenditure and so on. We need to be really careful because if we get it wrong, then we could actually do more harm than good. Yeah. So I really, I want to keep the acceleration going. I want to inject that pulse of adrenaline into the country, but I want to do so in a safe way.
At Davos recently, where the world leaders, political and otherwise, met, there was a panel that was hosted. And on that, we were discussing what's going right or wrong with India. In that, Geeta Gopinath went on to say that the biggest issue with India right now is not US tariffs. It's actually air pollution. I want to understand from you, why do you think the government has not, A, recognized the problem, not taken it at war footing, or even has a plan? What's wrong?
Yeah, it's a mystery, isn't it? Because, and again, let me just choose China as an example. So 25 years ago, I started going to Beijing. And when I went to Beijing, you go into the streets and it was like you were walking through treacle because the smog and the pollution, you could almost touch it. It was just so awful. And the Chinese government, they're not a democracy, so they just tell industry that all the industries are outside Beijing. They just shut them down. And they shut them down for a period of time so that the air cleans up. They put rules in place that they limit the number of cars that can enter the city. So over the space of a decade, they completely cleaned up Beijing. And they did that across other cities in China. So that now when I go to Beijing, oh my goodness, it's like walking in the countryside. It's beautiful and clean. It can be done. But as you say, it requires government to recognize that this is causing a problem for the health of the population. Now,
what is the health cost of air pollution?
Well, the health cost is, so around 1.6 million people are dying in India because of what's called particulate matter, outdoor pollution. Every single one of those deaths is preventable. So I would say, if I was a citizen of this country, why is my government happy to have 1.5 million citizens dying every year of preventable causes? That is not acceptable. No government should be happy with that. The public needs to say enough is enough. It will require intervention. It will, you walk around Delhi, the number of cars, it's crazy that you need to reduce the number of cars in the city. Industry needs to have much stricter, again, sorry to say, regulations about how much smoke and smog and chemicals are coming out of their factories. So it really, really does need a clampdown.
I think the problem is that everybody, I think there's no doubt in the fact that air pollution is a massive issue. Doctors have spoken about it. Environmentalists have talked about it. We are seeing results now in the number of cases that are going up on how hospitals fill up every winter. I fail to understand why the government has not addressed it like an emergency, like the slow death that we seem to be dying.
I think that the word you said is the answer, the slow death, because it's quite difficult to make the connection, isn't it, if you don't know the subject, between the air and dying. If I get hit by a car, well, it's pretty obvious, cause and effect. I've been hit by a car, that's me, snuffed out. But the air? Well, how is the air really?
You think the government doesn't know that?
I think the public doesn't know that, and therefore the public isn't actually making this an issue for politicians to take seriously. So what pollution does is it does cause cardiovascular disease. Pollution does cause respiratory disease. Pollution does cause lung cancer. These things kill us, but they don't kill us today. They don't kill us tomorrow or next week or even this year. They will kill us over a period of time. And so what's happening with the pollution that we've had in January 2026 here, we're in Delhi at the moment, but here in Delhi, is that we're laying down a time bomb that will affect the population in 6, 12, 18, 24 months. And so for a politician, it's a problem that seems a long way away. It doesn't seem immediate, but it's not a long way away, and the public needs to respond to that. So again, I want to see in your vigorous democracy people taking this seriously. And I find it bizarre that in a non-democracy in China, they took the problem more seriously than is being taken in a democracy here in India. It makes no sense to me. My question to you is, why isn't the public agitated more? Why aren't they asking more questions of their politicians? Why are they not saying, this is not acceptable. We insist that, and if you don't do it, we're going to vote you out and vote somebody else in.
I have a theory. My theory is that life in India is very hard. It is bloody hard. Just to get through the day is such a toil that people do not have the time to be agitated. People do not have the time or energy or resources to go and fight for what they want. And when I say people, I largely mean the middle class.
Yeah.
I mean, the middle class, where the problem basically exists. This is tax-paying citizens who are working really hard. They pay their insurance in time.
Yeah.
They want to get their kids through good schools. They want to pay for their university. They want to take care of their ailing, parents as well,
Yeah.
and manage somehow in middle of all this to have a good time.
Yes.
They do not have
Yeah.
the capacity to fight
Yeah.
with the government.
Yeah.
That's my theory, but
And I like your theory. It's entirely plausible, but that lets the government off the hook. And so what we need are civil society organizations. We need community groups. This is why we called our commission, by the way, a citizen-led health system. The idea that it needs to be led by the people. And one of the factors that I found really paradoxical, 4 million dead after the pandemic in India. And yet you go and do a survey and you find that an enormous number of people trust the government. I mean, trust in the government's gone up after the pandemic. It hasn't gone down, which I find weird. I mean, how is it that public trust in the government's gone up, not gone down after 4 million people have died? Well, okay, it is what it is. I think people should be more angry. I think people should be asking more of their governments. And I'm not making a party political point. I mean this for all political parties. Every political party should be held accountable here. And yet they're not. And maybe it is what you're saying, but and life is tough. I would say life is tough in lots of places, in lots of countries. It feels tough sometimes living in London. But I would just plead on my knees, don't let your politicians off the hook. They're there to represent you, us. They're being paid to represent us. Think about your children. Think about their futures. Make sure that they deliver for them.
So Lancet did come out with a report saying that 4 million people died because of the pandemic.
Yes.
And that got you into some trouble with the government, didn't it?
It did.
What happened?
Well, my understanding is that that's not the story they wanted to tell about India. The story they wanted to tell about India is that the management of the pandemic had been a stunning success. The reported figure that they submitted to the World Health Organization was less than 500,000 deaths in 2020 and 2021. Now, I think any reasonable person knows that that is a fantastical figure. It's plainly not true. There were some catastrophic failures. Access to some things as simple as oxygen didn't happen. There's nothing wrong with admitting mistakes. I tell you, every single country failed during the pandemic. It's not peculiar to India.
That's true.
There's nothing. My country, I wrote a book about what happened during the pandemic in the United Kingdom. And we failed. We failed terribly. We made mistakes. We took too long to lock down. When we locked down, we didn't look after our frontline workers properly. So we had high mortality in frontline workers. We didn't look after our healthcare staff properly. We didn't protect them properly. We had this crazy situation with elderly care homes where people were discharged from hospital, went to these elderly care homes and literally killed thousands of old people because they weren't protected. We made terrible mistakes. You know what? Admit it. Everybody was struggling. It was hard. We'd never had anything like this before. There's nothing wrong with making mistakes.
But have we learned?
No, you haven't. You haven't learned. And you haven't learned because you haven't had an inquiry into learning. We're going through a pandemic inquiry where all of the mistakes are being set out. And it's pretty depressing, but you know what? It's okay. It's like a truth and reconciliation process. It's like saying we went through this crisis. All these people died, often unnecessarily. We need to learn the lessons so it never happens again. That's what needs to happen here.
You're saying, forget learning the lesson, we've not even recognized the problem?
No, you haven't even recognized the problem. I mean, we haven't even got to first base about understanding that there were 4 million deaths. If you can't even admit that there was this level of mortality and there was this level of failure. You can't even begin to, and there hasn't even been a process to start learning the lessons, which means, I'm afraid to say, when the next virus comes, and it will, you're not going to be ready, and you will see millions of Indians unnecessarily die, which would be a tragedy.
No, I agree with you. So SARS-CoV-2 is not dead. It's alive somewhere. It's still mutating as we speak.
But it won't be SARS-CoV-2.
It could be SARS.
It'll be something else.
It would be
SARS-CoV-3.
SARS-CoV-3 maybe. How soon do you think it's inevitable that we will have another pandemic?
Oh, inevitable.
And is it inevitable that we'll have another pandemic in this decade?
Oh, now come on. What do you want? I've got a crystal ball in front of me. I can't tell you yes or no 100%. What I can tell you is that we are destroying our planet sufficiently to create the conditions for another pandemic in the next 20 years. We are cutting down our environment, our forests, our savannas. And what that means is that animals are coming into closer contact with human beings. You know, I've been to countries, I'm not going to name them, where you go to a market. And in this market, there is meat. And next to the market is the abattoir. And in the abattoir, they are killing animals and in the most awful, insanitary conditions. And then the meat is then just put into this market, not protected, covered in flies. People take offcuts of the meat and are selling them on the street. I mean,
10 countries are coming to mind.
Yeah, exactly. And these are the conditions where you will have the transmission of a mutated virus from an animal to a human being. And then if it's the right sort of virus that's going to be spread through a respiratory route, which is the worst possible example, then we're in serious trouble. And I tell you, if it's an Ebola-like virus with a very high mortality, we're not just in serious trouble, we're in species-ending trouble. So, you know,
What do you say?
We really, I am not exaggerating. We are creating the conditions on our planet where we could easily face a species-threatening event. So, you know, when there was the Great Plague in, hundreds and hundreds of years ago, we saw half of Europe killed by the plague. We could see that happening in the future. There's no reason why not. So I don't think people have had this. COVID-19 was a wake-up call to the planet to realize that viruses are all around us and we are very vulnerable. We are very susceptible to them. And we don't have the means to defeat them. Because when they come, they then mutate and you have the Delta wave.
But how do you say we don't have the resources? We live in the time where we can prevent, we have medical resources available, we have AI helping us, the world is coming together to fight these viruses, you have a lot of money being pumped in. So how is it that you're saying we won't be able to fight it?
Because we haven't recognized that we have a species-threatening event looming on the horizon over the next 20 years. We published a piece of work a year or so ago that estimated that the risk of a pandemic the size of COVID-19 over the next 20 or 30 years, up to 2050, is about 25%, which is very, very high. So between now and 2050, over the next 25 years, we've got a high probability that there will be another pandemic the size of COVID-19. Well, okay, why are we not recognizing that we need to put in place the measures? And the most important measure is surveillance. We need to be able to pick up mutated viruses. So this is what went wrong in China. It doesn't matter. Let's not get into the arguments about what was the origin of the virus. The virus was there. And then what happened was it wasn't identified. And then Wuhan was unfortunately a major transportation hub for Asia. But
there have been theories about whether or not it was identified. There were some doctors who did speak about it.
There were doctors who did speak about it, and could
never speak again.
But that's what the one guy, the first guy who did identify it and alert the authorities, he then unfortunately was castigated and arrested, and then subsequently died from COVID-19. And that's because you have a country that didn't have a proper surveillance system and didn't have a proper system for then, once there had been a problem identified, doing something about it. So we need to have a surveillance system, which means that you need to have laboratories that are constantly testing and picking up samples and identify and monitoring for viruses and strains of viruses that could be catastrophic. I mean, again, I say this with humility. In my country, we set up this amazing genome monitoring service during the pandemic. Fantastic. Did we keep it going? No, we didn't. We closed it all down. So we have put ourselves in a situation that is just as we were pre-COVID. We are absolutely not ready. And we've gone through an inquiry. You haven't even recognized, not you personally, your country hasn't even recognized there was 4 million people who were killed at least. And therefore, there needs to be, so you need to have genome monitoring services across the entire country to pick this kind of stuff up. But my point about China was that Wuhan, the first patient then flew to Bangkok. There was then a case in Bangkok, but by then there was this network that had gone around the world and we couldn't stop it. The only way you can stop it is by having around the entire planet monitoring stations where you can pick this stuff up, and then politicians and professionals who are willing to act very, very quickly.
How are you saying we're not monitoring? We live in a country today, urban India at least, let me give you a perspective. We are monitoring and tracking everything. We track our sleep, we track our food, we track our calories, we track our hydration levels, we track AQI. We track how bad is the water.
We're tracking the wrong things.
Everything.
We're tracking the wrong things. I track stuff too. I track my steps. What a waste of time. I'm obsessed about my steps. If I haven't done 5,000, 10,000, God knows how many thousand steps, it doesn't matter how many steps I've done. I mean, I'm obsessed about the wrong thing. What I should be obsessed about is that we have laboratories across the world making sure that we are monitoring viruses. And I tell you, again, another example. So there was this issue about Wuhan, and was it dealing with viruses that were dangerous? Yes, it was dealing with viruses that were dangerous. It was what was called a BSL, Biosafety Level 4 laboratory. We've got BSL 4 laboratories all across the planet. Are they regulated? Is anybody looking at those? Answer, no. A lot of those laboratories, in fact, the majority of them, are in low and middle income countries. Good, because that's where most of the viruses are likely to come from. But are they safe? No, they're not. Again, like the International Atomic Energy Authority is a regulatory system which makes sure that anybody that's doing atomic-related research, nuclear has nuclear power plants and so on, they have an appropriate level of safety, and they go around the world checking them. Is anybody doing that for biosafety level 4
but
laboratories?
Give me an incentive.
No, they're not.
Give me an incentive for all young Indians watching right now who want to be entrepreneurs, Gen Z, which wants to save the world, which wants to do things with purpose. If they want to do something in medicine, in health, give them an incentive to work on it. What's that incentive that will get young Indians to prioritize health, to work on it, make business out of it, and help the country?
Be part of a movement. Be part of a movement that is going to be about, I mean, I don't want to sound like some naive millennial here about saving the planet, but, you know.
Are you a millennial? You're like a boomer.
I am ancient. Well, I don't know what the right term would be for somebody with as white hair as I've got. But
okay,
look,
a boomer is answering a millennial question on Gen Z.
Oh,
now let's get an answer.
Okay. I think my 25-year-old daughter would be rather skeptical about whatever it is I'm about to say. Look, there are tremendous opportunities in the whole genomic space. We haven't fully realized the cracking of the DNA code all those years ago, 20, 25, 30 years ago. We have the possibility now of creating a library of genetic sequences of all viruses in the world. And that's what we need to do. We need to create a global archive of viruses. Viruses are going to kill human beings, ultimately. Sorry to be depressing about it, but that's the biggest threat to our species. A virus that mutates and will just destroy us. The only way to stop that from happening is to create this library of viral sequences and to have worldwide monitoring systems to be able to pick up mutations. And that's the way we can stop it. Now, for a young entrepreneur, electric vehicles are important. I want an Elon Musk of viral sequences of genomics.
You're saying we need a Tesla of health.
We do. We need exactly. That's exactly what we need. And why shouldn't it be in India instead of Silicon Valley? I want people to go into the life sciences. The life sciences are super exciting. Biology is the most exciting science that there is. It's the most complex science because there are so many variables, and to understand the way human life is evolving constantly. And the threats, let me put it this way. If I took you into the British Museum, I could show you Egyptian, Assyrian, Mesopotamian societies. And they're fantastic. Roman, Greek, amazing. But you know what? They're not here anymore. What's going on? Why aren't they here anymore? They're not here anymore because those societies didn't realize they were vulnerable. Those societies didn't realize that as solid as the rock was on which people walked in the homes that they live, the fact is, they disappeared. And they disappeared because they didn't think far enough ahead. Those societies vanished. Why won't our society vanish? Our society is just as vulnerable. In fact, it's more vulnerable than their societies because we've got more threats. So my point is, there's nothing special about the human species in 2026. We could disappear very, very fast. The Mayan society around 1000 AD was a very, very, very secure society. And then they had a few droughts, and within 100 years, they disappeared. So our society, you need a virus that comes along, our society could disappear in a few years. We almost saw it happen during COVID-19. So my point is, let's not be arrogant about this. Let's recognize that we are under threat and we need to protect ourselves. Are we protecting ourselves from the threats that we face? The answer is absolutely not.
So if I understand you correctly, you're saying the way for India to become a superpower is to ensure that we prioritize health. To outlive other civilizations, to outperform other civilizations, we got to get our health in place.
So, and I love the fact that you use the word civilization, because health can mean different things. There's the health of your body and my body. That's what we talk about with medicine. But there's also the health of our community that we live in. But there's also the health of our civilization. And by the health of our civilization, what I mean by that is, do we have the right political structures, the right economic structures, the right social institutions, the right environment in order to protect and strengthen our civilization? And that's what we've called planetary health. Planetary health is the health of our civilizations around us and the natural systems on which we depend. And the whole idea of planetary health is based on the fact that the British Museum is full of civilizations that are dead. And what I don't want to see is in 1,000 years' time, there'll be a little family going around a future British museum looking at, oh, look at those weird people from India and the United Kingdom. Weren't they sweet living in their little podcast studio? But how sad. They didn't realize that their civilization was so vulnerable and it disappeared.
Okay. Towards the end, I want to come to you on a certain checklist that we do here, okay? I want you to, like I said, we are at the brink of prioritizing health. I seriously think the conversation is changing. I think it has started. The pendulum is already moving. People are prioritizing health over sickness. People understand the importance of getting a doctor today, not who will cure you, but who will keep you outside of a hospital, who will catch before the house is on fire. I think people understand that. I think there's growing awareness, especially amongst young Indians, urban Indians as well. But if I were to give you a checklist of stuff, or if I were to ask you for a checklist of things that India should not do,
Should not do. Oh boy. I don't know. Look, I want to enjoy life, right? And I don't like a medicine that tells people to stop doing things. In fact, I get very annoyed with my colleagues in
Full marks on that one.
health.
Full marks, yeah.
You've got to, and I'll get killed for this, you know. I mean, don't drink, don't smoke, don't do this, don't do that. It's all about don't do things. And what about doing things? What about doing good things? What about doing things that bring pleasure to your life? So you've got to find this balance between pleasure and pain. And I don't want to be the kind of doctor that goes around just saying, stop drinking alcohol, you know, and also, you know, people, you said it yourselves, life can be tough. And when life is tough, sometimes you do things that in a very abstract way might be seen as harmful to your health. But the reality is, if it's what gets you through the day, then what's wrong with
indulge?
Yeah. You know what? If it gets you through the day, if you can if it helps you survive and makes you a better person and
I think it's a good time to put an advisory on any smoking and any kind of alcohol is injurious to health. Yeah. He could be a doctor and perhaps the most respected name in health across the globe, but he's not endorsing it. This podcast is not endorsing it.
I'm not endorsing tobacco, and I'm not endorsing alcohol, and I'm not endorsing drugs. But what I am saying is that medicine needs to be very careful about losing the trust of the public by just going around telling people what not to do. I think that we need to be much more sensitive to the lives that people lead. I'll give you an example. If I lived in a community where there were no decent schools and I was unemployed and I didn't have a decent doctor to go to and the environment was terrible and I didn't have a nice home to live in, you know what? If I drank a bottle of vodka a day and a packet of cigarettes a day, perhaps that's a perfectly appropriate response to the environment in which I live. So I'm not going to condemn that person. I'm not going to celebrate, but I'm not going to condemn them. And the answer is that improve the schools, give the person a job, get them some self-respect, clean up the environment, get a decent doctor in there, and then I might have an expectation that you look after yourself better. But I'm not going to condemn people for doing things that, given the life they lead, it would be entirely reasonable that they seek a little bit of pleasure in their life.
Lots of disclaimers, lots of them, full-page disclaimers going on this one. But talk to me a little bit about urban India. What do you think they're doing right, and what do you think they're doing wrong?
Oh my goodness! Look, this is a vigorous.
Let me paint a picture.
Okay, go on.
There are, like I said, it's binaries in India in every sense, in every way, in every corner. So is urban India also a bit of a binary, where you have obesity in kids, and you also have obsession with GLP-1. Okay, you have people who are not even aware they have diabetes, and others who don't touch sugar. We exist in those binaries. So my question to you comes from, what is that balance? How do I hit that balance without getting paranoid?
Yeah, and I see that. And I also see, because I mentioned I've got a 25-year-old daughter, and I see in her generation there is this, you know, they're constantly bombarded with pressure to look a certain way, behave in a certain way, in a way that I never had to go through. And I think it's much tougher being a young person today than it was in my day, certainly. You know, I don't have any simple solutions to that. I can only tell you what I say to my daughter, and that's just simply be yourself. Follow your heart, follow your passion. Don't let anybody tell you to be something that you don't want to be. The most important thing for me, and this isn't advice from a doctor, this is like the quest in life, isn't it, is to be the person you want to be. And so the thing you have to decide for yourself is, what kind of person do you want to be? And then to be that person. And sometimes it takes decades and decades to figure out the kind of person you want to be. But nobody else can do that for you. You have to do that for yourself. And once you've figured that out, honestly, I think everything becomes easier, because once you've figured out the person you want to be, then it's easy to make choices. But you really have to figure that out first.
I think I've just found the coolest doctor in the world. He asks you to indulge when you want. He wears a leather jacket. He's got a tattoo. So I think this is a good time to call it off. But oh my God, Richard, it's been an absolute pleasure.
Thank you very much.
Thank you very, very much. Thank you
you
for being here.
Thank
And
you
do
for
tell us
asking.
the story behind that tattoo.
The tattoo. Well, okay. My daughter got a tattoo, and I thought, I don't want to exit this world without a tattoo. So I woke up one Saturday morning and I thought, this is going to be the day I do it. And so I texted my daughter and I said, what would you say if your dad got a tattoo?
You took permission?
I did. I asked her because I didn't want her to think that I was some crazy guy. And so she said, Dad, it's your body. You do what you want with it. So I went off. I found this little tattoo parlor in Soho in London.
Can you show our cameras what that tattoo is?
And I walked down, and then Stefano, this lovely man, from Italy, Stefano did this tattoo for me. And the thing about tattoos is, once you've got one, you want more and more. So now I'm figuring out what the next one's going to be.
The next one.
The next one's going to be an isosceles triangle also here. So
the meaning being?
The meaning, it's aesthetic. It's purely aesthetic. It's just like, you know what? Your body is for painting.
On that note, thank you.
Thank you
You so much, Richard. This was lovely.
Thank you very much. Thank you.